a motherhood. While there are some non-verbal signals by which they can make informed consultations about the state of the intercourse, it is important to pay attention to the entire gesture pattern, to the person's posture, his facial expressions and intonation, and at the same time take into account the entire context of the situation. Pay attention to the children's gestures then he tells you something or answers a question. If the baby brings his hands to his lips as if covering his mouth with them, then such a gesture indicates a subconscious attempt to stop the false worm coming out of the mouth. Young children then speaking a lie very clearly cover their mouth with one or both hands immediately after telling a lie. Teenagers trying to deceive also bring their hand to their mouth, but instead of directly closing their mouth, they lightly scratch their mouths or trace the lip line with their fingers. Sometimes, instead of covering his mouth with his hands, the child may begin to cough. This is a kind of attempt to hide the truth behind the cough. Subconsciously, the deceiver believes that no one will disassemble the lie behind the cough. If a child unconsciously touches his nose during the story, then most likely there is little truth in his words. This is explained by the fact that lying irritates the delicate nervous endings in the noise, and such a lie scratching of the noise comes the nose. Pay close attention to whether the child looks into your eyes while talking. If what the baby is saying is not true, then he will avoid looking you in the eye. The child rubs his eye, it indicates a subconsciously attempt not to see the parent's gaze to whom he is telling a lie. Then a child is not telling the truth. He may touch his hand. In young children, this gesture is manifested by the obvious covering of the ears with the palms. Adolescents can simply rub their ears or fiddle with the lobes. Twitching of eyebrows, meeting of lips, twitching lips, twitching chin. All these are also things of embarrassment behind which may hide the desire to hide something. Then the words spoken by the child are not true. He may involuntarily scratch his neck in the area under the ear or the entire neck, or he will begin to pull the collar. Then telling lies or waiting to hide information. The child may try to hide his hands in these pockets or behind his back. Open palms always speak about sincerity, honesty, trust, and loyalty. The one who speaks the truth opens his palms in full or in part. Pay attention to how the child answers the question asked. If he tells a deliberate lie and realizes that he is doing wrong, then he may begin to speak in a quieter voice. It is necessary to be guided not so much by the sign of quiet laughter as by the change in the usual tempo of speech. Notice if the child answered the question right away. If the child asks each question you ask and answer with your own words, then most likely there is not much truth in this version of the story. In fact, by asking again, the child is simply trying to buy time in order to come up with the most appropriate answer. Then he answers with your words. It means that he does not want to speak his words.
Привет. Действительно. Конечно. Думаю, парочку вспомню. Нет, к сожалению, я уже не помню, как я себя вела в тот момент. Верно. Да, конечно, замечала. Дети отводили взгляд вниз, в стороны, опускали глаза, и было долгое молчание. Рада помочь. До скорой встречи.
Привет, действительно, конечно. Да. Да, помню. Краснел и не смотрел в глаза. Рад помочь, до встречи.